Okay, I am going to talk to you now about how to do a urinalysis, the chemical portion, as well as the visual portion of urinalysis. The supplies you're going to need are a pair of gloves, an antiseptic towelette, a urine cup, a chemical indicator strip. This is the bottle that it comes with, but you guys at home have these laminated sheets to work from. A tidy towel, or right now I have the autoclave paper, and that works too. And then a way to track or log your results. Now these are located under files under chemical urinalysis results, so that you can access that, and it'll help you kind of keep track. Now you also need a way to keep track of the time, as these tests are time sensitive. So I have another cell phone out so that I can do that. So first thing we need to do is make sure that we counsel our patient on how to collect a clean catch midstream sample. It's the most accurate. So we're going to give them a towelette as well as a cup. We're going to explain to use this to wipe front to back from the urethra opening, and then we're going to have them go ahead and start urinating into the toilet. And what that does is it flushes out any debris that might be inside, just the very inside of the urethra. We don't want that in our test results. We want an accurate test of what's in the urine, not sitting in the opening of it. So we have them wipe front to back with the towelette, which cleans the area. They start to urinate in the bowl, which allows us to push out any kind of debris that's hanging out there, and then we collect what's in the midstream. Now the patient doesn't need to fill up the entire cup. They're going to think that they need that, so go ahead and tell them that it's okay to only fill it about halfway. Once they have collected that, they need to have their name on it and the date. Okay, and then once we get the sample, then we start to process it, and that's what we're going to do here. So I'm going to go ahead and get my gloves on. I'm going to move the tidy towel out because I have a surface already for me to work with. Okay, I'm going to move that out of the way. Now, we have this indicator strip. Now, the ones that I've sent you have this blank white box at the bottom. That's your ID box, so you can put the patient's initials. This will not have a result. We're going to start with the teal colored one, and we're going to move from the bottom up to the top. This starts at 30 seconds, and so on and so forth till we get to the top, which should be read within a minute and a half. We're going to use this plastic laminated sheet, and what we're going to do is dip this into the sample so that all the strips, all the boxes have been wet from the urine sample, and then we're going to place it on our card, and we're going to slowly, one by one, working from the bottom up, match what color is closest to the patient's sample, and then notate that on our piece of paper. So, patient's name, I'm going to go ahead and put that on there. My handwriting is not the best, and you guys know that. 7/18/78. Today is 4/29/20, and my initials go on there as the medical assistant. It is 2:10 in the afternoon. So I'm going to write that there. Now, when we go through the chemical and visual portion of the semen analysis, or not semen analysis, but urinalysis, what we're going to do is look at the color. Now, this has been in the fridge for a few minutes as I sat up, so it's nice and cold, but the color is kind of a pale yellow. It's not very dark, so we're going to write that here under the color portion. I'm just going to circle that here. Now, clarity. A way we can check this is we can put something that has writing behind the sample and see if we can read through it. If it's not able to read or notate the information on the other side, then we can go ahead and say that it's cloudy or turbid. Okay. Then the next thing we're going to do is smell the sample. I know that doesn't sound fun, but the smell of it can explain to the physician what could be going on. So it smells like normal urine, so I'm going to go ahead and write down that it is aromatic. Okay. It can smell foul, it can be sweet, it can be fruity. Somebody with maple syrup disease can even have their smell like maple syrup. So we're going to take our indicator strip, and I'm going to make sure that I push it all the way down into the cup, shove it down so that it has all of the boxes wet, and I'm going to tap the side of the cup to make sure that everything is off of, that I'd have the excess kind of tapped off. And now we need to wait 30 seconds before we can read our sample. Okay. In 30 seconds, we should be able to read the glucose and the bilirubin, which are the first two boxes. I'm going to go ahead and get my pen ready because we are almost at that mark. So we are at the 30-second mark. So what I want to do is take my indicator strip and line them up. Remember, that first box is just your ID. It's not what we're going to notate. So we're going to move from here. In the glucose, it's similar to the negative color. It doesn't have any green or brown variation in the color, so I'm going to write it down on my card as being negative. The next one up is the bilirubin. Again, this is done at 30 seconds, which is right now, and it is similar in color to the negative. If it was positive, it would have a slight peachy pink color in it if there was positive, but we do not have that in this sample, so I'm going to notate a negative on my paper. At 40 seconds, we're looking at the ketones. My ketones are also negative on my sample. It has that light pink color. If it gets brighter pink and into that red, almost purple color, then there's positives. We can sometimes see that in patients that are on a ketone diet or an Atkins diet where they limit the amount of carbohydrates that they have. If this is positive, then we want to make sure that we ask that of our patients if they're on a special diet. The next one we go up, the axorbate is not one we have on our indicator strip here, so we're going to skip that on our paper, and we're going to go to specific gravity next. Now, the specific gravity is talking about the concentration of the urine, and so mine on this sample is probably closer to that 1.025 mark, right in here. So I'm going to mark that. Okay, the next one up is blood, and it says it's negative for blood. It's the closest thing. Now you can either get little marks, little dots of green in it, or you can get solid green and in varying colors if it's a positive, but this sample is negative. Next is your pH. Now, this pH talks about the level of acidity in your urine. This patient has what's close to a 6.0, this first box right here. So that's what I'm going to notate. Next is protein. Now, that negative is more of a yellow color, and I do have a slight green to it. So I'm going to put a +1. Because I think it's closer to the green than it is the yellow. It might not look like that on the camera right now, but in person it does have a slight green to it. So I'm going to put a positive on that, a trace amount. The next one is the bilirubin, and we are going to look at that, and it is it's right here at this normal range, but it's at the upper end of normal, I think. Maybe not. No, it looks closer to the negative than it is the next box over, so I'm going to go ahead and notate that as a negative, or a 0.2. The next one up is the nitrates. Now that should be white. If it is any color of pink, then it's a positive, and we'd mark that, notating how positive that is, but this sample is negative. Last but not least is your leukocytes. Now that is also negative at this time, but that's one of those tests that can turn positive once that 2-minute mark has expired. So you want to get to that one quickly and in the right amount of time. Not that it shows a negative, a false negative, but we don't want it to show a false positive either. So we do have to get it in that sweet spot of the 2 minutes. That's all the information that we give to our provider. We notated what the information was that we got from the urinalysis by marking the boxes on here, and then it's up to the doctor to interpret that information. I will wipe this down with a sandy cloth so that I can use it again, and I'm going to dispose the urine into the toilet and then throw the cup away. Do not dispose your sample too early. Keep it in the refrigerator until the patient has gone and you've confirmed with your doctor whether they want to send it out for analysis or not. And that's it.